The Achieve mapping catheter is an intracardiac electrophysiology diagnostic catheter. The distal mapping section of the catheter is a circular loop with 8 evenly spaced electrodes to map electrical conduction between the left atrium and the pulmonary veins. The Achieve mapping catheter comes with 2 sizes in loop diameter, 15 mm and 20 mm. The shaft size is 3.3 French, and it is designed for use with the Arctic Front Cryoballoon catheter. The catheter may also be used for cardiac stimulation during electrophysiology studies. When approaching an Arctic Front procedure with Achieve, many of the same guiding principles exist when you use a guide wire. There are, however, techniques that can be utilized to maximize the performance of Achieve. First and foremost, above all else, obtain occlusion. One can obtain occlusion through angulation that allows for good contact between Arctic Front and the pulmonary veins with good coaxial alignment. Coaxial alignment means having a common axis between the pulmonary veins and the cryoballoon. The picture to the right demonstrates this priority. Once you have obtained occlusion, then visualization of time to effect during pulmonary vein isolation may be possible. For a successful Arctic Front and Achieve procedure, it is important to not sacrifice occlusion to see time to effect. The backbone to obtain occlusion with Achieve and Arctic Front includes aligning the Arctic Front system, including Arctic Front Balloon, FlexCath and Achieve, with the tubular portion of the pulmonary vein. Assessing or visualizing the level of occlusion. And adjusting as necessary the Arctic Front system to best achieve coaxial alignment. This process can be employed to approach each vein and cryoablation application in a stepwise manner and should be done with an understanding of the patient's anatomy. The Arctic Front system, Arctic Front Balloon, FlexCath and Achieve, needs to be aligned with the tubular portion of the pulmonary vein. This is a very important step in obtaining occlusion. When using Achieve, remember to use the FlexCath and balloon deflection to navigate the system to the antral region of the pulmonary vein. If the system is not in alignment, any force that you push the cryoballoon with will be displaced away from the pulmonary vein. While assessing, ensure coaxial alignment by checking your occlusion in LAO and RAO views. It may be possible to view time to effect, or TTE, during cryoablation applications. To maximize the opportunities to view TTE, some experienced users keep the Arctic Front Balloon and FlexCath constant once occlusion has been obtained and draw their Achieve catheter slightly backwards till it is near the proximal tip of the balloon. Occlusion needs to be obtained first and foremost. If occlusion becomes too difficult with Achieve, switch to a guide wire.